This is Stephen, and in this video we will talk about using echo to study tricuspid regurgitation. Now, as we talked about before, you can have problems with a leaky valve due to problems in the door frame or due to problems in the door. In the case of the tricuspid valve, if you have tricuspid regurgitation, it's much more likely to be due to right ventricular dysfunction, pulmonary hypertension, something like that, rather than due to a problem with the valve leaflets itself. And so let's look at our apical four-chamber view. Left atrium, left ventricle, right ventricle, and our tricuspid valve and right atrium. And so let's say we have, let's say that these leaflets are supposed to be closed, but we still have a fair bit of leak. You may see a zone of convergence up here, and then you may see it come down to its most narrow point, and then you may see a large jet back here. And you may be tempted to just look at the jet size and leave it at that. And if it is occupying more than 50% of the right atrium, that does suggest it's a severe regurgitant jet. But we can look at a couple other parameters as well. And so if we want to grade whether it is mild, or if it is moderate, or if it is severe, we can use our PISA technique that we talked about in prior videos. If our calculated regurgitant area, effective regurgitant orifice area, is less than 0.2 centimeters squared, that would be mild, versus if it is more than 0.4 centimeters squared, that would be severe. We can also measure, as we talked about in another video, our vena contracta width. That's this width right here of the jet at its narrowest portion, which is like a quick way to estimate. You have that, which is a diameter, and then that's a quick way to estimate what the regurgitant area is. So vena contracta width, if that is more than 0.7 centimeters, that would be concerning for a severe degree of tricuspid regurg. And again, if you remember, if that's the diameter, then 0.35 would be the radius, and you can do pi r squared, and that ends up being quite close to 0.4 that we actually get with our PISA. And then just like with mitral regurgitation, there's a couple other factors that, that go along with severe. Often with severe, you will see dilation of the right ventricle, and you may see systolic reversal of flow, in your hepatic Dopplers. What is the idea there? The idea there is that you have so much regurgitant flow that it's going back, your SVC, your IVC, and all the way back down here. And if you measure flow in the liver during systole, you're actually seeing that flow's reversing there in the liver as well. That's the idea behind this, looking for systolic reversal in the hepatic Dopplers.